Right now, as I said, from my current season, I am a mother. That's who I identify as right now. And I think once you're a mother, you're always a mother. And that's the first thing you think of. Other than a mother, I am a wife, a daughter, a business owner. I own a dental practice in Isleworth. Like you mentioned, course provider. As much as I love clinical dentistry, I'm quite passionate about the communication side of dentistry. You'll find something in common, Maybe they don't want to talk much to begin with. So, a lot of people focus on, I need to connect with them straight away. Not necessarily. It might take some time. It might be when you're taking the x-rays, at that point you try again.
What is going on, guys? It's been a long time coming. I've been really busy for the last couple of months, but we're back on it with Dr. Asif Talks. And we've got an amazing guest here with us today. Fantastic dentist. Very, very well known on social media. Great with the community, great with students, runs a lot of courses. Very, very inspirational person. I can't wait for you guys to meet her. Let's bring it on. Dr. Asif Talks. Been a long time coming.
Yes, it has.
But thank you so much for joining me.
Thank you for having me.
No, it's fine. You made it all this way to, you made it all this way. I made it all this way
That's
to
what I was
finally
about to
get
say.
you on board. But I've been looking forward to this for a long time. And we follow each other on social media. This is the first time we've met. Mm-hmm. And I'm very curious as to, what you get up to as a dentist, but also your social life, because mashallah, you've got a family, you've got kids, and also you run courses and you're a dentist. How many things you're doing? And I'm very, very keen on knowing a bit more detail about that. But how about you tell the viewers, who is Raabiha? Dr. Raabiha, should I say?
Who is Raabiha? Such a broad question.
I know. That's why I wanted to start off with.
Oh, God. It's going to start with a little closed question. Who am I? I don't even know. So, as you know, I had twin baby girls, mashallah, 9 months ago. Mm-hmm. So mashallah. I can't remember who I am most of the time. I don't remember what day of the week it is. I know we had to set a time for when they were sleeping. So it's 8, 9 o'clock right now. I had to come when they're asleep. But right now, as I said, from my current season, I am a mother. That's who I identify as right now. And I think once you're a mother, you're always a mother. And that's the first thing you think of when you're sleeping, or when you wake up in the morning. I think about my children, and every 45 minutes when they wake up in the middle of the night, I'm thinking about them. I don't even say anymore that I'm going to bed. I say I'm going to have a nap, because I know they're going to wake me up soon. But other than a mother, I am a wife, a daughter, a business owner. I own a dental practice in Isleworth with my husband and my brother. It's a 5-chair mixed practice, and we do NHS private dentistry. My husband's a chiropractor and a physiotherapist, so he works there as well. Like you mentioned, course provider. As much as I love clinical dentistry, I'm quite passionate about the communication side of dentistry and how we make our patients feel. And I think that's more important sometimes than what we're actually doing. So that's what my course is about, the patient journey. Kind of how to get your patients to trust you, to build that connection, that human connection that I feel often a lot of dentists are missing when it comes to the patients. At university we become very robotic, and clinical dentistry makes us feel very robotic. But I want to kind of take that robot side away and remind dentists that we're human first. So we remember to connect to our patients as humans, and then dentists second. And gosh, now I'm thinking where else.
No, it's fine.
And
that's
then the book. Actually, you mentioned your wife has the book.
Yeah.
Yes, which is
that's amazing.
I always find that so surreal. That's something me and Nicola wrote together on Microsoft Word with those text boxes that kept moving every time I input information in. Is actually a textbook that people use in dental school.
That's amazing. Honestly,
it gives me giant imposter syndrome and anxiety. Sometimes I'm like, you
should be proud.
They're using my kitab. I wrote a book.
They're highlighting the words that you wrote.
I know, and I'm like, when we first released it as well, it took us 2 years to write.
Wow.
And when we first released it, I was literally about to give birth, and I was finalizing it with Nicola and 2 of these dental students that really helped us, Puya and Milad, to put the book together. And Nicola had a lot going on as well. Her father had passed away, and we were just like, release this book. I can't look at this anymore. I'm like dreaming of text boxes now. And you know, when it first got released, we were seeing like typos coming back and content that was wrong, and I was like, we need to correct and republish. So
that's crazy, man. So where did it all start off then? There's so much I want to ask you right now, but I don't know where to start.
Where do we start? You started with the open question.
I started with the open question. I should have written notes about this. I think I need to write a book about you. But most important thing is, what came first? Did you get married, then become a dentist? Or
so we're doing timeline now, Raabiha's timeline.
Yeah. We won't go into too much detail, of course, but I just want to know like what came first, because mashallah, you've done a lot. You know, you've written a book, courses, you've run a practice. What was that timeline like? And I can tell each year, mashallah, you're adding more and more things, and your family's getting bigger.
Yeah.
So did something inside of you think, you know what, I've not finished yet. This family is now making me want to go out and go do things, because I maybe want my kids to be proud of me. So what was that timeline?
It's actually the reverse.
Oh, was it?
I've slowed down now. I have kids.
Oh, really?
Yeah.
It looks like, mashallah, you've done even more. Well, according to what we see as obviously people on the other side of things,
No, since I have kids, I've actually slowed down. So a lot of this was kind of before.
Okay.
So the dental practice came in 2020. So that was at the height of the pandemic.
Oh, yeah. Wow.
Dental practice came. And then as soon as we got the keys, we had to close that down.
Oh, my God.
And it's the first thing we did as bosses. And we were painting. And I was like, oh, God, this paint stinks. It's disgusting. I'm tired. I'm like, how am I getting tired painting? And then I found out I was pregnant.
Oh, my God.
I was pregnant with my first, Alana, who's 3 now, mashallah. And then in terms of the book, that was... Wait, I think the book came... Did the book come before the practice? Yes, the book came before the practice. I was writing the book alongside trying to purchase the practice, because that took 2 years. Yeah. So the book and the practice together, and then the course was before the twins. Because I realised that when I found out I was pregnant with twins, I was like, I'm going to be off for a while. So I would like an income that can come and help me stay at home. And Salik, who I met a while ago, he does all these courses and things, and he'd been chasing me for a while, do a course. And I was like, what am I going to teach people? I have nothing to teach. And he was like, no, teach this. Like, you know, he'd come into the practice for marketing, and he'd seen how I interact with my patients, and he was like, you can sell this.
Is he a dentist?
He's not.
He's
not.
Okay.
He does marketing, business, all sorts of things. Okay. He's non-dentist, but he does own a dental practice.
All right, amazing.
Yeah, he recently bought one, but he was like, you could sell this. You know, dentists are really rubbish at this. And I was like, no, this is basics. How you talk to someone is basics. How you make them feel is basics. It's being normal. He's like, no. He's like, this is not normal for dentists. Trust me. He's
like, realized after, yes, this is not normal.
He's like, this is not normal. This is not what like a dental room is normally like. Yeah. You can sell this. So then I sat down. I just started writing it down. And he would, you know, I showed it to him. He was like, oh, this is good. And he was like, look, I do bits as well. He's like, we could combine this and make a course. And I was like, okay. He goes, what's your goal? And I was like, well, to make some income, to pay for a cleaner so I don't have to do that stuff, and I can focus on my children, and pay for someone who can cook some meals so I can focus on my children. And he was like, an online course will do that for you, because you can make some money and be at home. And I was like, okay, I will do this. And I was like, if you think it's going to help people and it's going to help me, why not? So that's kind of the order of things.
That's amazing, man. I don't even know how you even had time to get a practice, write a book, and then you're pregnant. Like, it's mashallah, it's amazing, because it's inspiration to people out there. Did you ever sit back at that point and think, it's getting too much, I've had enough, give the keys back, the practice is COVID, I've had enough, I'm just going to chill at home?
Day one, I was like, I wish I got the return receipt.
I was going to say, because during that COVID time, it's difficult. I know people started buying more practices after COVID, because that's when there was a bit of a boom, and people were setting up squat practices and all sorts. But like, you've just bought an NHS practice, you've gone back now to what, barely 1 UDA a day. And we're looking like an astronaut. You know, we're dressed up like crazy, and then you're pregnant, you're writing a book. Or did you have this drive in you and just think, you know, I don't care, I'm just going to keep going and going and going, see the end goal? I
think because when you're pregnant, you've got a little ticking time baby.
Come
on, get it was a baby. So you know, you have to. You had a timeline to follow. But I'd already spent a year on it before the practice came. So I had a year of the book. So I was like, just keep going. You know, we've got another year now. We can just keep going. But I can't say there was a driving factor. I had partners and everything.
Yeah, mashallah.
With the dental practices, my husband and brother, and without them, it wouldn't be possible. And even to this day, it's only possible because they're part of it. You know, I feel like I am the back. In the shadows, I don't, you know.
You're the dentist.
Yeah, on Instagram, I'm the face of it,
Yeah,
but
yeah.
really, I feel like I do the least. So they do so much, and without these two, the dental practice would be non-existent, and I would have returned it a long time ago. If it was that easy to return a dental practice, I'd be like, please take it back. You know, I'll pay you to take it back. Dental practices, not as fun as people think.
So are you predominantly still like in the NHS then?
We've converted it now. So it was 3-chair when we took over, and now it's 5. But it was initially like 80% NHS, and now I would say we haven't reduced the UDAs, we've just upped the private. So maybe we're even 75% private.
Wow.
So
that's amazing. So you've literally just seen it grow.
We've just literally, like I said, communication, giving patients options, just changing the vibe of the practice, how things are done, and doing it how we would
how
like.
Important is that communication? Now, I originally, before I released my anterior posterior composite
I'm excited
course,
for that. Even you're releasing a course. It's mad.
Well, you know what? Originally, I went for communication, but not to your lot's level. Like, mashallah, the way you lot do is on a different level. Mine's was sort of photography combined with lab communication, patient communication,
That's
portfolio,
important.
practice managers, and all that type of stuff. Things that I've obviously picked up on, and I realized that honestly, like people out there, dentists and non-dentists, don't know how to communicate. Even just simple things, you know, like the horror stories I've heard from other dentists. So I've got a funny story.
Tell me.
There's a dentist that I work with, amazing dentist. I've learned a lot from him when I started doing private. So this dentist, so funny, he came up to me, goes, I asked another dentist for a little bit of help recently, and he came in and he must have been chatting to like, I don't know, like a patient.
Yeah.
And, you know, the patient must have said something just like, oh yeah, I avoid certain foods because, you know, I'm scared that my veneer might ping off or something might ping off.
Yeah.
And then this guy just gave a cheeky response back, and he goes, yeah, I'm not surprised you avoid it. And then just walked off. And I was like,
What?
That's the maddest thing. Like I wouldn't even dare to say anything like that to a patient.
Yeah.
And then people like that might complain about their private being a bit less in the month, or the diaries being empty. How important would fixing that be when it comes to your private? Is it really straightforward? Speak nice, you earn more. Would you say?
Do you know what? It's not even. Yes, speaking is a part of it, but I think it's when you take all of that away and you just, you know, like I was mentioning earlier, focus on the patient. So part of my course, I offer mentorship to people. And what I do, I get them to film themselves with patients. And one of the videos I watched her basically be a robot. So patient came in, hi, how are you? How's things going? Okay, good, please have a seat. My name's X, this is my nurse. Okay, I'm just gonna ask you a few questions. And then, you know, do you smoke? Do you drink? Any allergies? And the patient, this was her speech. Now the patient who walked in, hi, yes, yeah, I'm good. I've got a toothache, my top tooth, and she repeated herself a couple of times. The dentist said, okay, first, we just got a few questions. Okay, first, just a few questions. And then the patient, again, is like, but the top 7 pain, and you could see that
this was recorded.
This is recorded.
That's crazy.
This is recorded. She recorded and sent to me with the patient's permission and everything.
Yeah, of course. Yeah.
So obviously, so I could then tell her, look at this now.
And did they realize?
Can you see what's wrong? They didn't. She was like, well, I have to go through the medical history. I have to do. It's like, well, yes, you do. But can you see that person was trying to tell you something, that they're in pain, and you were more concerned about the questions you needed to ask rather than what the person was trying to tell you. I said, you can tell the person is nervous. So she's probably, you can tell her English isn't good. So she's probably rehearsed this answer in the waiting room thinking, okay, I need to say it like this to the dentist so they understand where my pain is. Maybe someone's helped her rehearse this. And she's just trying to tell you something. And you've kind of asked how she is, not cared how she is, and then cared about your medical history. And then she was like, oh, you're right. And when I said it to her, she was like, oh my God, you're right. And like watching herself back, she was horrified.
That's crazy. Yeah.
And I was like, would you treat someone in the street like that? Like, would you talk to a normal human interaction? Would it be like that? You ignore what they're saying. They're telling you they're in pain and you're like, okay, you know, what is it out of 10? Is it a 6? Is it a 7? It's like, oh my God, I'm so sorry to hear you're in pain. That must be awful. Like, where's the compassion? There's they're forgetting to be human. And that's like, you know, they've got to ask the severity. And I was like, you know, I know what it is. They're afraid of being sued, because in dental school, you're going to be sued. You're going to be sued. You know, so you have to get all the questions, you have to get all the answers, everything right, because if your answers and your notes are perfect, they won't sue you, because the GDC will be like, yes, you put in there that they have 3 teaspoons of sugar in their tea, and you got that they floss, you know, so you're not going to be sued. This dentist is perfect. I was like, people don't complain against people they like, you know. So you could literally pull out the wrong tooth. Not that you'd want to, but I mean, I have seen it happen. But the patients love that dentist. They're like, no, but they're so nice. You know, the first time, actually, I'm like digressing, but the first time I realized how important communication was, when I was in 3rd year at dental school, and this patient came and she had like grade 3 mobile teeth. I mean, I could have done this and the teeth would have come out. And I was like, oh, so how come you've been referred to the oral surgery clinic? And she had like no complex medical either. She's like, oh, my dentist, he didn't want to hurt me. He's just such a wonderful man. You know, I've waited 6 months to have these teeth out. I can't eat. And I was like, oh, but they're very wobbly, aren't they? And she was like, yes, but he didn't want to hurt me. He thinks of me like his mother, you know. And I was just listening to her. I was like, he's CBA to do this. That's why. That's probably the real thing.
Listen, he claimed that bun too.
He probably was like,
attempted extraction, partly removed the tooth, Bantu, off you go, mate. Got patients waiting outside.
I don't know why he didn't do them. And so I was just like, oh, okay, he sounds really lovely. Let me just take these out. Tick, 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 you know? So it was like, I didn't even need a fork. I literally just touched it and they fell out of her mouth.
I do it all the time.
That's when I realised communication is just so important.
So are you seeing that more with like the younger generation dentists, recently graduated dentists, or do you get that with like older generations, and you look back and you think, hang on, you've been working for about 15 years and you've been talking like that? Like, who's more commonly like, you know, experiencing these difficulties when it comes to communication?
It's interesting actually, because my mentees range, they're all different ages, and some. It's all of them actually. They all are affected by things. I think they have different problems, different specific problems. Like the older ones, generally the communication is okay because they've been doing it for a while, so they've kind of understood, you know. And when I say older, I mean maybe 36, 37. I haven't got anybody over that. I don't think they go on Instagram, so they don't know who I am. But you know, that range. And then you've got the new ones in the 20s. But they have slightly different concerns. Like the younger ones are more scared of being sued because they're fresh out and following their templates and being very robotic, and the older ones are just kind of, they're polite and they're nice, but they're just building that kind of communication set to, like, you know, the word, I hate the word, but conversion. Getting people to go for non-NHS and going for possibly private treatments or going for EMAX crowns. They sometimes lack that kind of conversation. So slightly kind of different problems, but everyone has, I think. I think dentists generally have a specific personality type, and they're not very good with people.
They're good on social media.
That's why they're like operating their mouth when the patient doesn't talk back.
Bit of skiing do you know what I mean? Like, I think dentists love doing that. But you're right though. Like, I think when it comes to that communication, is so important. What if now someone comes, like a patient comes in, that patient just doesn't want to talk. And that dentist is like, I get loads of these patients. Do you just give up? Or are you trying to like get them to have a little conversation? Because sometimes you get a patient, it's like, yeah, okay, can I go? Can I leave? Not literally, but they're like, their body language is just like, I don't want to be here. Get me out. Are you still like telling dentists, like, you know, give it a shot, give it a try. You know, they might open up to you. Because sometimes even I struggle with that. Yeah. I'll sit there, I'm like, do you watch football? Tell me you watch something, please. don't just ignore me. Put the gloves on, then off I go. Yeah. But in that situation, is there anything that can be done?
Yes. You don't give up. Because you're not going to change who you are for them, right? So if you change how you talk to this person now because they're being blocked off, which they could be blocked off for a multitude of reasons, like previous bad experiences, they don't trust dentists, they've got loads of problems happening at home, and then you kind of stop trying to get through, then the kind of care you provide is not going to be reflected in that interaction. So you're still trying to build a connection. You'll find something in common, you know. Maybe they don't want to talk much to begin with. So, you know, a lot of people focus on, I need to connect with them straight away. Not necessarily. It might take some time. It might be when you're taking the x-rays, at that point you try again. Like how I describe it is like chipping away. Just they will crack eventually. I've never had someone not crack and become conversationalist in themselves. So you'd find perhaps, you know, that moment when your nurse has gone to develop the x-rays and you just talk about something. So doing anything nice this weekend?
Just go up, persist.
Yeah, just they might not say anything. No, well, you know, then I start talking. I'm like, you're not going to talk. I'm going to keep talking. Yeah, I'm going for a barbecue actually. I literally do not stop talking. When I first started working with my nurse, she should be like, Raabiha, when I go home, I have to take 2 paracetamol to go to sleep because your voice is still in my head. But now she's the same nurse messaging me, when are you coming back from maternity leave? I miss you. And she's the one who's talking to the patients.
That's amazing.
But don't give up. Don't change yourself. They will eventually. And one of my mentees actually said that she gets really, like, if someone's, like you said, closed off, she's like, fine, if you don't want to, in her head, she'd be like, fine, if you don't want to make effort, then I don't want to either. I'm not here for, you know, for free, like, just whatever, just have your feeling, get out of here. But she goes, she changed her mindset, and she noticed one of the patients actually flipped and became soft, and at the end she was like, that person actually was like, yeah, okay, and listened to what she said, and she was like, that treatment plan ended with, you know, Emacs crowns, a laugh, and, you know, I'll see you next time. And she was like, I was really surprised because normally I would have been like, but she was like, I kept thinking, you said chip away, so I just kept trying, and it worked. So
it's true. I read this book once, the one book I read in many years. But this book was amazing, and it actually spoke about that, where you obviously chip at people and you obviously go into a bit of depth, but the main concept of the book was, if, for example, this is based on real life experiences, if you meet someone and you know what they're interested in, or even if you know nothing about them, just chat to them, get a little interest, and you just work off that. So for example, you like makeup, I don't know anything, but I'll be like, oh yeah, you know, my sister, I don't have a sister, but my sister, you know, she loves makeup and she always goes to this random place, and you'll just randomly start talking. I'm like, right, okay, blab on, I don't care now. I've kind of achieved that. And this guy spoke about very, very successful people in the world, from artists to people who play golf to business people who have all done this. But it's so simple, but why is no one doing it?
Finding common ground.
Yeah, I don't understand, like, where we live in a generation now where social media has like benefited us, but do you reckon it's also caused this problem of a lack of communication? We're stuck behind the phones, can't be bothered talking to people, then you actually forget how to actually hold a conversation. Do you reckon that's a big sort of factor when it comes to that?
I think not for our generation in this sense, because we already built our communication skills. I think for the younger generations now that are on iPads and doing all the homework on iPads, and that's how they interact, I think they do lack communication skills greatly. You know, you read about it, that's going to be a big problem, because they're not talking to people, you know. And communication is not just what we say. So people can say, oh, we're talking on our phones, or we're, you know, it's actually how you make someone feel in your presence as well. You know, it's non-verbal, which they say sometimes is up to like 80% of it, you know, what 60 to 80, depends what you look at. But that's a large part of communication. So
face-to-face interactions.
That's so
it's like
important.
marketing. Like social media, people will be like, oh bro, you know what, you've got 20,000 followers, or he's got 10,000 followers, so he'll be getting loads of patients. And I'm like, most patients, it's word of mouth. Like, that's how it works. Word of mouth only comes from their experiences. That's one thing I've realized anyway. Like, I know on my social media do a lot of desi content and the most random content.
Well, that's how I started following you.
Yeah, no, exactly. I popped up with maybe a samosa talk or something.
Yeah, no, it was a dand uppar something. Oh my God.
The uppar and the thalle.
Yeah, the uppar and the thalle.
Listen, those experiences are genuine experiences. Like, I forgot I was speaking to a patient not long ago, and this patient comes in, and this is after I've spent months making content about like Punjabi. Patient comes in, and the patient's like speaking, and they spoke like 1 or 2 words, and I was like, yeah, you know, basically you got gum disease, you know, it's grade 3, blah blah blah. And she was like, oh, Punjabi. And I was like, I genuinely went Punjabi, and I wanted to laugh. I was like, you're playing me, because a few patients recognized me from my social media. But one thing I've realized is, as much as I can be the hype man on social media and a million of followers, for me to get the patients coming in, like that word that we don't like, conversion, is through experiences. And I've realized just literally just chilling at work, being myself, like, you know, forget about GDC, forget about everything for now. Just have a little chat with the patient, sat on the chair. Like, honestly, I'll just sit in front of them sometimes.
That's how you should
slide
be.
my chair forward.
Face to face.
Yeah.
That's
and I
a
don't
normal
put my gloves
human.
on.
The dentists do the whole back to the patient.
No, they do.
You need to be face to face. You need to see your eyes. That's why when everyone had the masks, there was no connection. You need to be able to see someone's face.
It's true, and it's so important. Not just dentistry, even with your family.
Yeah.
You know, it could be with your partner, even just generally day to day.
Yeah.
You run, mashallah, a few businesses, so it's not just patients now. You're also dealing with it on a business level. Do you feel like that's, mashallah, helped you become a better business person then? That better communication, you know, having people next to you, partners that you can work with? Or do you reckon, you know what, actually, I could do this solo and I'll be all right?
No, I couldn't do it solo.
Yeah.
Nicola wrote the book with, couldn't do it without her husband and brother practice. Would never do it without them. I've had that question before, like, isn't it better just to buy a practice by yourself? You know, more money. I'm like, yeah, more money, more headache, more problems. I didn't buy the business for money. You know, I bought it to do something of my own, to grow something, to hire staff the way I want, to build something, you know. I actually make less money as a practice owner.
But it's not about
Everything
money.
bloody goes back into it.
Yeah.
Not now. If you bought back in the day for peanuts, then you
Yeah.
make money. But now when you're buying for the millions for the tea, you know, it's literally... It's not worth it. All this goodwill. That's what I call the dirty. It's like, what? I'm paying what? How much? How much for goodwill? 1.5 million. Oh, okay. Thank you. Thanks. Yeah.
But it's experiences.
No.
End of the day, you're doing it the way you want to do it.
Yes.
You're running it the way
It's
you
the autonomy.
want. So nowadays, that's what dentists want. Dentists, every dentist wants their own practice.
Because they think, you know, why am I giving 50% or, you know, 60%, whatever they're giving to their bosses? They don't realise that's how much everything goes back to running the business.
And it's quite easy to just set up a squat practice. Like, I've seen semi-detached houses have squat practices, and I've seen squat practices in, like, on the 4th floor of an office building, and I'm like, this is mental. Like, how the hell did you even get a chair up there in the first place? A forklift, come on, just shove it in through the window. But do you encourage that for some of these associates as well? Like, would you encourage it? Because I don't know how to answer that question.
To buy a practice?
Yeah, like when people come up to me,
to
like,
set
bro,
up
I
a
don't
squat.
know, should I set my own practice or shall I buy an existing one? And I'm like, I don't even know if I want to do it myself. But, or is that something now that you'll be like, yeah, you know what, you're probably better off going, you know, or...
Our associates do. Like, one of them wants to, and we help them, encourage them. Like, you know, they brought practices to us. Like, what do you think? Should we buy this? And my brother's the one that I'm like, yeah, I don't know about the money side. You go look at the finances, and he'll go through and be like, nah, don't buy this practice. You know, especially 1 chair, 2 chair. You don't want to be buying small practices. The amount of headache in running it goes into a 1 and 2. You're better off with a 3, 4, 5. You end up making more money for the same stress. You know, same overhead. So, I would tell my associates first why. You always have to find your why before you do anything. Before you make a course, before you buy a business, before you have children, like, your why has to be correct, right? So why do you want to buy a practice? Oh, I want to be rich, you know, I want to get 100%. You know, buy a practice. Go do something else, like maybe actually run a physical course or a PG dip and charge 14k or something, you know, or forget dentistry.
That's the dream.
Or forget dentistry and do something else that'll make you money. But practice ownership, you know, that's not going to make you rich. So you have to get the why right. And if their whys are right and they find a good practice, we encourage them.
I can see the passion in you though, mashallah. I can see that, you know, on your social media, from what I've seen, mashallah, and all the courses and the way you speak, that you've got that passion to go for it. But I feel like a lot of people may just want to do it for the money. They're just like, yeah, you know, I get a footballer in and I learn a bit of money and then that's about it. And a lot of people have said it to me. They're like, oh, you know, you've got a bit of a platform. Why do you build a practice? And I'm always like, I kind of want to do something that's separate from a practice. I still want to get into business, you know, with my little product that I'm launching.
Yeah, I'm excited.
My course. It's all just baby steps at the moment, but I want to bring something different. That passion is key. I feel like some people out there just don't have that. I've seen a lot of dentists that it's just like bish, bash, bosh, literally in, out, get the paycheck and off you go. Do you know what I mean? And if you get someone that's on your course or they inquire like, Dr. Raabiha, you know, I'm getting a lack of communication, blah, blah, blah. Do you even say to them, say, look, you're lacking a bit of passion? Or do you think that's a bit harsh?
Actually, that girl with the video where she was robotic, I said to her, I was really quite harsh because it was like the third video I'd seen similar to that. And I was like, you're a robot. And I got a bit frustrated with that at one point. I was like, I'm giving you advice that, you know, you need to progress, and you're not taking it on. And I said, I would not like to be your patient. I said, would you like to be that person's patient? There's no connection. I can't see your face. You're facing the computer. You've obviously got no feeling in that room. There's no vibe. It's so dry. Like, I had to get harsh. Sometimes I do, and for their own betterment. And since then, she's flipped, and she is so happy. Like, and I mean super happy. I'm trying to make sure I don't accidentally like reveal who she is. But she's so happy in what she's doing. And she says it to me. She's like, I actually enjoy going to work. And it's not just with the patients now. The environment with your nurses, reception, your team changes. Because if you can't connect with your patients, you're probably kind of, I keep saying tutty because I don't want to say the other word. You're probably tutty with your nurse as well. You're tutty with the receptionist too. Because dentists I feel like a lot of dentists are dry personalities, very arrogant. They, you know, in the interviews they say, I work really well in a team and I'm a great leader, but they're not. They're not. And quite a few of the mentees, the first problem has been, oh, I can't get on with my nurse. My nurse she's not good. And I'm like, the nurse is the problem. If you can't get your nurse to like you, how are you going to get patients to like you?
That's a big one. That
you spend every day with this woman and she doesn't like you. Bloody hell. And you want to get this person who's in your room for 15 minutes to like you.
It's true,
hello. Work on this audit
first. What's the first thing that a nurse would say to you that's been working with another dentist? They'll come with you, they'll work with you, they'll sit with you and they'll be like, yeah, I don't like him. I've requested the manager to put me in with someone else, or, you know, like some of my nurses are like, they'll just say like, oh, I've left the group chat, I've done this and that. And you think, hang on a second, how can someone be that bad? Or it could be like some guy just comes in, rocks up in his car, you know, just walks in like a Chaudhry Sahib into the surgery. So where's my jar? You know what I mean?
It's the one that the Mazda was been like, oh, my son's a dentist.
They do that 400 dentistry where they're like, give me my tools, and they're just looking in the patient's mouth, and you're like, all right, like, I think just take it a bit easy. I don't think this nurse even knows what 400 dentistry is. Like, you know, they'll probably struggle to do that, but they come in with high expectations. At that stage, it's like, I think you're better off getting your own practice. Do you know what I mean? And I think, unfortunately, I see that quite a lot. And with me, I've just been like, I'm just going to be chilled out. You're my nurse. Forget being my nurse. Let's just chill. Let's just have a good time. And I say that I make videos with them. I'll be talking about samosa and pakore. And I remember a few years ago, I even made a video with my nurse about, I'm going to give some Bollywood movies on the screen and you're going to name it. And she was like, Kabi, Kushi, Kabi. And oh my, it just blew up. And she's like, she's never heard of these Bollywood movies. But that's the way I am. But sometimes, do you ever think that it's just bedded in you? That personality, like, it might be hard to engrave it in someone. Like, some people just rock solid. You're like, oh, I've given up on this person, man. Do you want a refund?
I actually say to them, I'm happy to refund you.
Can I pay you to leave?
If you're not happy, but alhamdulillah, it's not happened. Alhamdulillah. And I take it as like a personal mission to make sure, you know, it's a success. You know, I like that. I like that challenge. That's actually when people say to me, what do you like about your dentistry and patient interactions? I actually like the difficult person, the difficult patient that comes in is like, I hate dentists. I hate you, hate your face. And then they leave like, I only want to see her. That's like my goal, and I love that.
That's wicked.
And with my mentees, it's the same thing. And some of them, you're right, it's a personality thing. So I tell them, just fake it till you make it. If you do not like to talk to people, you're an introvert, you do not want to make small talk, you hate it, let's find a few ways to help you make small talk enough to build a connection. And then I give them some foundations as well. Like, you talk about it in my course, how, you know, just forget dentistry, forget everything first. What do you enjoy? You enjoy drilling, filling. That's what you want to do. That's all you want to do. You don't want to deal with the person around it. Now, how are you going to get that person to come back to see you for that drilling and filling? Because now people have access to social media. They can come see anyone. So why are they going to come see you? Especially, there's a lot of the dentists now, especially the younger ones, they don't want to do the amalgam nash bash. They want to do bonding, veneer, smile makeovers. So I said, that means the patient can go to anyone. Then I have to come to you for your 5K plan. They are going to have to like you for that. So get interested.
Yeah.
So if you don't know how to make small talk, just ask them questions about them, get to know them. And I said, with that, you can also find out why they want to have these teeth done now. If they got a wedding coming up, a party, what is it about them that makes them want to have these specific treatments? Why do they need to have these specific treatments? And then slowly you will find it easier to start making small talk, and then train your nurses to make small talk.
That's a good one.
You know, so they can give you a hand, and then you can work off the back of your nurse. If your nurse has done really good at asking them about the weather and the weekend, you can be like, oh, you're going golf because she's done the hard work. Then you can be like, oh yeah, I like golf.
Me and my nurse do that all the time. Like a patient will be sat down, and they might be like, oh yeah, it's a bit chilly outside, and I'm like, oh, you were saying it's a bit cold when you got out of the car. I've just made some random stuff up. It's true, it probably did happen, but I probably just kind of like added a bit more masala to it or something.
The cold masala.
And my nurse is like, oh my god, I had to take the washing out, and oh my god, I was freezing. And then the patient's like, ha ha ha, and I'm like, I love this environment's nice, but I'm not faking it. Like I might add a bit more masala to it, but overall I'm enjoying that. I'm like, perfect. Now we can crack on with me shoving this needle in your mouth.
But that's because you made your nurse comfortable as well, like you said. So a lot of dentists say, my nurse doesn't say anything. It's like, well, because you haven't made her comfortable enough to feel that she can be a part of that surgery. They're just like that weird loner person that's in the back of the room that you don't even introduce most of the time. Dentists don't even introduce their nurses. The first thing I do is introduce her. I'm like, this is my nurse Andrea, and she's going to be helping me today. And my name's Raabiha. I'm your dentist. And I don't even say Dr. Raabiha. I introduce her. They already know if I'm the dentist, I am Dr. Raabiha. But if I call myself Dr. Raabiha, it breaks that relationship, right? I'm trying to build a human connection and a friendship. And why am I going to put my doctor title there? Because then that already creates a barrier.
It's true.
100%. You know, you have to think, what would you do if this person was like on the street? How would you do it?
No, it's true. Like if my nurse leaves the room and she's gone to look for an instrument, let's say it's a specific rubber dam clamp. And I'm like, where the hell is she gone? She's gone for about 5 minutes. I'll turn around to the patient. I'm like, I think my nurse has legged it. And they'll just start laughing. And I'm like, yeah, don't worry. She'll be back soon before she knows it. Like all of a sudden, I've made myself feel comfortable. But I'm like, let's imagine I'm just staring at the patient like, the only thing I can do right now is put that rubber dam on. And then you just sat there and you're like, pretend to go on the keyboard. And like, how's your day been? And they're like, you just asked me that about 3 minutes ago. Then you don't know what else to ask. So sometimes I'll just break the ice and say something random. And then they'll start talking and I'll start talking. So sometimes you do get that awkward moment and you're like, I don't know what else to say. Brain fog is kicked in, and then you just gotta let it out. At some point during your, mashallah, like, you know, that course about communication, do you feel like you're more of a life coach? Because I feel like, mashallah, you're more of a life coach, because you help them with communication, but you're also trying to understand the dentist and what they're like as a person, because you can tell them, go in, communicate like this, but sometimes it's good to just know, hang on a second, but you're a bit of an introvert, like what you mentioned before. So you're more of a life coach, aren't you, in a way?
Do you
look at that with honor, or do you sit back and think, I'm happy to just be communication?
I'm like, I'm underqualified for this. I'm still figuring out my own life.
Motivational talks on stage soon, TED Talks.
God, I'm
but like, you know, that's mashallah, that's a privilege that people are like coming up to you and they're like, Raabiha, I don't know what to do. And you're like, right, let's break it down. Tell me about you, your life. Have you got a family? Have you got kids? Because that plays a role, doesn't it? In everything. It helps make it. Or am I just talking nonsense?
No, when they sign up, so I get them to fill out a form about what their problems are, etc. And then I'll call them and then I'll talk to them as well. I get to know each of them individually, like if they have kids, what practices they're working at, why they joined on, what do they actually want me to help them with. I have a few men, but generally my mentees are largely women, and a lot of them either thinking to buy a practice, some of them just associates in a practice, want to be better associates, some who want to balance their life with children and how to do it. And it's funny when you said that life coach, one of them said that the other day. She was like, I feel like sometimes, I'll show you this. I'll show you the screenshot.
That's wicked, man.
And I said to her, I was like, can I share the screenshot? I think I did the other day. But she was like, sometimes it does feel like you're a life coach because I feel like I can trust you with problems in my life, which is actually, it's such an honor.
Nice, mashallah.
It's such an honor. And I realize sometimes I feel like I'm starting to enjoy this more than clinical dentistry, because I realized what I enjoyed about clinical dentistry was the people and interacting with them the whole time I was doing this kind of, it it is artistic job, but talking with the people, making them feel comfortable and safe, and making them laugh and changing their perception of dentistry and dentists, I love that so much. And so now being able to do that for dentists, so they can do that for other people, I think I love that amazing. More. I really do.
Wicked. How do you now, mashallah,
juggle
this?
So it's my birthday in December.
Is it?
So
how old are you going to be?
I'm going to be 34.
Because it's my birthday in December.
Is it?
Yeah.
What day?
December 9th.
I'm 19.
Oh my God, look at that.
How old are you going to be?
I'll be 32.
You're a child.
I know. By 2 years.
Yeah, but still, anybody younger than even 1 month, you're a child.
Oh my God. So how do you, mashallah, then juggle this? Mashallah, you got kids, you got twins. I've seen how cute they are on social media, mashallah. But it can be a bit difficult, like, let's imagine. It's not like someone's sending you a case, right, upper right one composite needs a bit more polishing. You're like, right, I got to break this down to you. I got to now have a conversation with you, figure out what you're about before we break down the communication barrier and everything like that. So you got to dedicate some time for that. Mashallah, how do you juggle it? Because that's a
nap time. So twins nap twice, so nap time. Sometimes they'll just be playing on the floor, and then I'll be like voice notes, and it's not just communications with patients. They come to me with complaints or treatment planning, like how do I explain this to the patient?
Also, it's that as well.
It's everything. So communication, people think it's just how do I make someone feel?
Just talking to the patient.
No, it's everything. Like okay, look, this person, this is the case, and I think, and I ask them first, what do you think? Right, so I want them to think first. I want, why do you think this? Okay, you think this plan is good for the person? Why? Because obviously I haven't seen the patient, so I don't have the X-rays or moles or whatever to be like, this is a treatment plan. Go do this. So I'm like, okay, you think this for this reason. Now this is how I would articulate it to my patient. This is how I would show them with photos, with X-rays. Okay, but I only have 15 minutes. You need to extend that time. You can't get to know a patient, give them effective treatment plan in 15 minutes. Ask for 30 minutes. How do I ask my boss for 30 minutes? Okay, this is how I would have a meeting. Yeah. So this, and a lot of them have changed to 30 minutes.
That's difficult, because what if a principal turns around, let's imagine, and says, I need 50 UDAs by the end of tomorrow. Like, would you say to them, I think you should just leave and go somewhere where you get that 30 minutes?
It depends what they want from their job. Now, if they just want to nash bash, make loads of money, and then they're going on maternity leave, and that's what they need for their NPE, so they get paid well on maternity leave, then go bash. That's fine. Yeah. But if that's not what you want, and you want to be doing some NHS, some private, then you need to have that conversation with your boss. Now it depends. Are you happy at this practice? Yes. Okay. Do you like your boss? Yes. Okay. Sit them down. Tell them why you need 30 minutes. And a lot of them are quite nervous to do that. And I'm like, look, they're just people. It's your boss, fine. But you can talk to them and say, look, in half an hour, I'll be able to X, Y, Z. Give me 2 months or 3 months of half an hour exams, or even a month, and I will show you the increase in revenue. And I was like to them, I will guarantee that you will get an increase in revenue.
That's wicked.
Because they do. Because if you give people more time, you have the time to not just be like, amalgam filling, metal crown, okay, off you go. You can be like, these are your options. You could do white fillings here. Okay, you can't afford it? Let's do 1 a month of the white fillings, if that's what you want. After you've discussed, obviously it's a long discussion, but I'm just kind of like summarizing. And okay, fine, you want a metal crown, not a problem. You want to have white fillings here, not a problem. So you need to have the time to have these discussions, so you have to invest time to make the money.
That's amazing that. And now you're doing that with 2 babies crawling on the floor.
Fine. And all my mentees know that I've got kids as well. So they might be like, I'm holding one. Or when you called me earlier, I was like changing a nappy. And I was like, I'm just changing a nappy. And so everyone knows. And then when they go to bed, sometimes I'll do video calls if they need.
And you feel okay, like, mashallah, like, do you still feel like, mashallah, you got the energy now, that's it, bring me on more students?
But I told you, I had like maybe a total of 2 hours sleep last night. Wow. Because they kept waking up so much. Crazy. And there's 2 of them.
I know. Oh wow! Yeah.
So then they're waking up separately. Then I'm awake.
Oh god.
But
do you find that right? Okay, I'm awake now. You know what? I got a message.
No, I did at when early stages when they were newborns and I was awake. So then yes, but now I'm just like, okay, back to sleep. You need to sleep.
Yeah.
I'm trying to prioritize myself a little bit as well, because
which is important.
I realize that if you don't take care of yourself, then you can't give anything to your kids if you're breaking and falling apart. And what do you give your children? I can't give them a broken, dysfunctional mother, which is what sometimes I give them. I'm like, a zombie mum they're getting. But
so how do you plan on doing that then, Raabiha?
So
what's your plan about doing that?
Plan of self-care. My husband's going to be like, I want to hear this, because he's always telling me, Raabiha, just do you first. I'm like, no,
Yeah.
I have to clean the
He's
house, I have
right,
to feed
though.
the kids, and then I can go eat something. He's like, eat something, drink some water, then, you put your own mask on first before you put on theirs. That's what they say in the plane, right?
Yeah, it's true. Yeah.
So I still do that sometimes. Yeah. I need to clean everything. Everything has to be clean, tidy, feed the babies, change their nappies, and then I can like drink more water and brush my teeth at 12 o'clock. But
You're telling your patients to do it and you're like, I barely just get time to do it myself.
Yeah, but no, I'm trying now. I'm like, okay, I'm fighting that like crazy voice in my head and be like, shut up.
Yeah.
Okay. Now go. You can drink that water, Raabiha. It's okay if they're fussing for 1 minute. It's not a big deal. Drink the water. Eat the fruit. Do just a bit more self-care. And now I'm gonna find an exercise class that I can do in the evenings.
That's good.
Or something. I try to exercise with them, but they just now they can crawl. They just like crawl on me, jump on me. The yoga is just interrupted.
It's like Twister.
Yeah.
You're playing Twister with them. They're like, I got this, and you're like, what the hell? You're kicking my head in.
Yeah, it's not fun. It's not
Yeah.
relaxing with them. So I need to do it when they're.
Oh, that's good. Because at the moment, mashallah, it's dentistry. Right now, in your head, practice, course, books, everything dentistry. Talking, you open your message and you're like, oh, it's all dentistry. And mashallah, we do it with passion, alhamdulillah. When you've got love and passion, you'll never hate it. You'll do it continuously. And you said now you're making effort to do that. Do you ever just kind of like sit back and think, you know what, I'm going to take a week off work. I'm just going to go on holiday. I'm just going to chill. I'm just going to forget about work. Because I find that hard sometimes. Mashallah, I've traveled with the family. I went to Japan recently. And even then I felt like part of me was like, is work still, like there, like in my emails, is it there in my DMs? It's a patient messaging me about, oh mate, my feeling's broken, or this is broken, or whatever's broken. I'm like, shit, like I can't escape this life. Or do you sit back and think, actually I'm gonna switch my phone off. I'm gonna switch everything off. I'm just gonna chill, give myself time, because you run a business as well. I'm just an associate at the moment, eventually hoping to run a business, but do you ever do that? Or do you think, nah, I've got too much responsibility, I don't think I'll ever be able to switch off?
Do you want to
completely.
be able to switch off?
It depends, because that's a good question. I enjoy what I do. So I do enjoy, sometimes it's a bit of a thrill. A patient messages me, I'm like, yeah, you know what, I'll have a
So
little
you don't
chat
mind
with
it,
them.
right?
So I don't mind it, but sometimes I feel guilty. And I sit back and I think, I shouldn't be doing this. Like, alhamdulillah, I do dedicate a lot of my time.
Why do you feel guilty if you enjoy it? It's not stressing you out. It's an enjoyment. So for certain people, it's not good, right?
Yeah.
Other people who find it stressful and I can't switch off. That's different to someone who thinks that, I should switch off because it's bad. It's because somebody else has told you it's bad. But for you, it's good.
I think that's what it is.
Right.
If you hear it from someone else, this could be like another dentist that's telling you, and you're like, oh, you're low-key throwing an indirect that, if I go on holiday, I need to switch everything off. And I do, alhamdulillah, like I dedicate a lot of time. You chill, you have a good time. But naturally, you are going to just make sure things are okay, because you are going to return back to home.
Yeah.
I haven't just said bye-bye, guys.
That's what they say, isn't it?
Off
Build
I
the
go.
life you don't need to vacation from,
Yeah,
right?
yeah,
So,
yeah.
you can't just, work like crazy for like 4 months and then take 1 week to like have a break to escape it, and then again work crazy for 4 months. Doesn't make sense. Most of your time, you're doing something that you're not happy with. Doesn't make sense.
It's true.
It makes zero sense.
Yeah.
And you're only happy for 4 weeks of the year when you're on holiday.
Yeah. It's true, though.
Or the other 48 weeks, you're miserable.
That's the last thing that you want, man.
Yeah. So if you enjoy tuning in, like I enjoy listening to my mentees and talking to them. Like, I did go on holiday. I went to Spain and Portugal with the kids a
nice,
month ago.
mashallah.
And it was enjoyable, but it was also, when you have kids one day, you'll know that once you're a parent, you're always a parent. And when you take babies and small children on holiday, it's like just parenting in another location.
Yeah.
They still have naps, they still have bedtime, But I always say it's easier to nappy change next to a beach than it is to nappy change at home, in front of the telly. So the change of scenery is good.
Yeah.
But I didn't feel like I had to escape. That's why I was going on holiday.
I like that.
I was going because I wanted to go with my sister-in-law who came from Australia. I wanted to just go experience something different, different food. So you need to think of your whys. So if you feel like when you are going on holiday, you don't mind checking, that's not a problem.
Yeah.
And if you do find that problem, then those are the kind of people that shouldn't be business owners, because you can't switch off if you're a business owner unless you are a partner in a business, because then you can switch off. Sometimes you can be like, it's fine, my partner's going to take care of it and I can fully go relax. But if you enjoy it, then I don't see any problem and being switched on.
It's like
all the time.
delegate, you know. I've read another book, surprisingly.
You've read a lot of books.
Another book. Over 32 years of my life. These are when I was a baby, not joking. But this other book that I read was about delegating. Like, you got to give other people tasks, but if you run a business, you want to be the core of everything. So sometimes you got to take that step and think, I know it's my business, I know I built it, I'm attached to it, but I've got now this person that's part of it, so I'm just going to pass it on to them. Do you think that helps as well with, mashallah, with what you do?
Yeah.
You know, giving other, because the communication, it's not just yourself, is it?
Nope.
It's someone else you partner with. Do you guys, mashallah, like have a good balance in what you do? Because obviously dentists, they're gonna look at you like, Dr. Raabiha, you know, and you know, you'll be able to be like, right, okay, you know what, actually, I'll own up, I'm not too great at this, but that person's perfect. Because I've done that, and I've learned to do that as a dentist. Yeah, I like doing root canals, I'm not amazing, but this guy next door, he's kingpin. Go see him. And straight away they're like, you know what, we trust what you say.
Yep.
And we'll go see him.
Yeah.
So do you sometimes just put your hand up and think, you know what,
All
I'm
the time.
amazing? Yeah. Which is great.
I
which
know
is
what I'm good at, and I know
Yeah.
what I enjoy doing, and I know what I'll give the patients the best of, and I know what I won't. And I just think if I was in that chair, what would I want to hear from somebody treating me?
Yeah.
I don't want to go to let's say a surgeon, and they, you know, and let's say I've had a heart attack, and they've only kind of done heart surgery twice, and they're like, let me try it on her, you know.
She might survive.
Yes, she might be okay.
Yeah.
You know, I might as well just do it for fun.
Yeah.
No, I want the surgeon to be like, do you know what? I know someone who is going to be amazing at this, you know? And I would be like, okay, you know, I trust this person.
Yeah.
So as a dentist, I do the same thing. I tell my patients, you know, if I needed a root canal, I would go see Dr. X.
That's
you know,
good. That's nice.
this person has actually treated my mum's gum disease, and they're fantastic. And that's who I would choose for them. However, I also provide it under the NHS, and if you want to see me, I'm more than happy to do it for you. But this is who I would personally choose. And when you build that relationship and you're clear and you're honest, they don't mind. Like a lot of people say, oh, but don't we have to do everything? No, you don't have to do everything. You have to be honest about everything. And how the patient will believe if you are honest is when you build that connection and that kindness and that, you know,
that's nicely put though. It's
Yeah.
true though. And I think even from myself, that's still outside of dentistry as well. It's still something that I'm learning. Like social media, I love doing everything. I want to record, I want to edit, I want to do everything. And then sometimes I sit back and I think, I just got to understand that there's some things that I'm good at and there's some things that I'm a bit rubbish at. So you got to be able to delegate tasks. Over, mashallah, this amazing career that you've had so far, inshallah, you will continue to have an amazing career.
Thank you.
What's been your biggest challenge, Raabiha? What would you say? Like, you sit back and you think, you know what, bloody hell, that was difficult. And you overcome it and you've, mashallah, ended up where you are right now. You know, just so people can resonate with difficulties in life maybe and challenges that they've experienced or they're experiencing.
Difficulty. I think it's an ongoing battle, and that's being a mother and also a clinician, practice owner. I think it's always when I first had Alana and the practice, I felt like guilty because we'd only had the practice for like 9 months and then I'm now on maternity leave. So not fully present at home, not fully present at the business, feeling guilty that I'm not a good enough business owner, feeling guilty I'm not a good enough mother. So it was that thing. And people talk about balance and you see people balancing and they're looking amazing doing balancing. And it's like, how are you bloody balancing and juggling everything? But really, I don't think it's true that you can have it all or balance it all. I think something always has to give, you know, and you just have to accept that being imperfect at everything and then finding certain times in your life where you make something a major focus. So right now my children are small, so for me in this season of life, motherhood is my focus. And then after a few years they'll be in school, and that time they're in school they're not going to need me as much. Well, they will after school, but when they're in school,
I still need my mum.
I still need my mum.
I'm 32, please.
I know.
Cook that biryani.
I still need my mum. I'm a mum myself. I can't believe it sometimes. I'm like, oh my God, this child thinks I'm a responsible adult and I'm supposed to be like regulating my emotions to help them regulate their emotions. I don't even know what I'm doing most of the time, you know. I'm looking at Instagram videos for advice, like, is this correct? Am I being gentle? Am I being firm enough?
Social media is the most difficult thing to look at because the things that you'll see there and you're like, oh my God, I'm not like this. I'm 32. And what the hell, this person's like got a family, businesses,
this person's making their own gummy sweets for their child out of watermelon juice. Like, honestly, I have to keep reminding myself, comparison is the thief of joy.
Yes.
This is like my mantra. I have to keep
100%.
and not just dentistry, in your own life as well. I'm like, oh God, this mother's so much better. She makes her child's OT bars, and I'm buying organic OT bars. Now bread is poisonous, so I have to make my own bread. So I think it's just doing what you can and just stop feeling guilty for everything and just know that you're doing your best, and that should be good enough because you keep trying. And I think that is probably a hurdle that I'm constantly fighting with myself.
I think a lot of people are fighting that hurdle. Even for myself, like every day, you know, what you see on social media, it's not 100% true.
No,
you see the Desi content, that's 100% true. I'm 100% doing that. But like just anything like comparison. I spent the first few years of my career comparing myself with other dentists. How are they doing bonding so early in their career? What the hell?
They qualified yesterday.
I can't even do a class 4. What the hell's going on? I don't even know how to build a tooth up. Like there was just so many little things. Until I did that, I just woke up one day and I was like, you know what? I'm done comparing. I don't care how much you earn. Earn quadruple my amount. If you're in my little inner circle, I'm gonna be so happy for you. But if you're not, it's okay. Like I'm honestly just not bothered. But then sometimes you get reminded of that when they're driving a Porsche 911 and I'm there in my car, which alhamdulillah I'm grateful for. It's a nice car. But then I'm sat back and I'm thinking, I should have just done a bit more Nash bashing. What are future projects like for Raabiha then? Got anything? You don't have to spill. Mashallah, I know you'll be up to something. But have you got something in your mind and you think, I want to work for something particular? Maybe it's a different course. Maybe it's a book.
Well, we are releasing the second Diane soon. Nicola's been doing a lot of work on that, bless her. I was pregnant, sick, and so she's just taken the lead on that one. The first one, I was like, go, 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 and this time she's like, go, go,
Where
go.
do you even, like, I don't mean this in a bad way, where do you even get this knowledge from to write a book? And people read it and they're like, yes, I'm going to follow these steps.
I know, honestly, I still get anxiety thinking about it.
If I wrote a book, I'll call the dentist. I'll be like, just please let me know his patient alive. Because I hope, like, I'm confident in myself, but you're not following my steps.
Trust me, I don't think anyone was supposed to buy this book. I'm not sure what happened, how people started buying it and using it as a textbook.
But it's amazing though, like you've literally got everything to a T.
Well, how first it was just writing everything, like what I knew. Then it was getting all the existing books, comparing it to that. Then it was using Nicola's knowledge and my knowledge again, going through it. Then it was getting specialists to peer review it, give us their information.
So you even got specialists to peer review it?
Yeah. You can't release an endo chapter without an endodontist or a perio chapter without a periodontist. So then we got specialists like, please, like, look at it. Is this correct? Then make changes that they advised. And then before we were releasing, like, new perio guidelines came out, I was like, crap, we have to change this to like PRP now, PMPR. Like, what is this? No more like scaling.
I know. I used to love scale and polish. S&P. Now S&P's in the stocks.
Sorry, mate. So things are always changing in dentistry.
I can imagine. So anything then you're going to work
in the pipeline, apart from releasing that book.
That's still amazing though.
I think I just kind of want to, because we also have a platform, Diane Club, so we're still working on that. It's like, it was based on the book, and the idea was to have videos of all the procedures. And it's something I've asked you to contribute towards as well. So trying to build that up. So that's taken a long time because we didn't realize how hard it is to build a website. You know, we built a book and we just printed it on Amazon. That was easy.
Don't get me started
but
about websites.
A website is hard. A functioning website with all the features. Trying to release an app, which Apple keeps bloody rejecting, it's really, really hard. And then trying to get content for this while I'm on maternity leave and she's running a business. It's so hard. So I just want to make what we have better. So building up Diane Club, releasing a good Diane 2, and then we're going to have to proofread it, condense it, because I think it's going to be like this big, the second book. It's going to be an encyclopedia.
Full of knowledge though.
Oh, God. So I think it's just condensing what I have. I don't have anything new, but I feel like I'm happy with what I have.
That's wicked.
I'm not looking for anything extra right now.
You don't need to, mashallah. That's amazing.
My twins are
that's more than what anyone else
job.
is doing. No, that's amazing. So if, for example, you meet a dentist for the first time, or there's someone out there just watching this podcast, and they just need one thing, one piece of advice you want to give them. Could be anything. Someone could be out there like, don't get a loan, or someone could say something like, make sure you work hard. Like, what's one piece of advice you'd give someone before we start to end this podcast? Something that you think may have worked for you.
Piece of advice. I think know your whys for everything that you do. and focus on what makes you happy and why you're doing what you're doing. And like we mentioned a little while ago, don't compare yourself to others, because your circumstances and your journey is unique. And often when I speak to dentists, they're happy doing what they're doing. And the reason why they feel they might need more or something different is because they think that's what they should be doing based on what others are doing. But if you're happy doing what you're doing, then it doesn't matter what anybody else is doing. So just, I think, be happy where you are while trying to work to where you want to go, if there is a goal you have in mind. But I think just trying to be present and blocking out the noise and social media and what people around you might be doing, because like we said earlier, everything on social media isn't 100% how it seems. There's a lot behind the scenes, and everyone has battles they're fighting that you know nothing about, you know. So just, you know, focus on you and your whys.
And for those people that have got a family,
they're
trying to balance everything, what would you say for them as well? Because that, I'm sure a lot of people can sit back and think, you know what, mashallah, what you're doing is amazing, and they're probably struggling with that. What's that piece of advice that you can give them as well?
A lot of my things that I was doing was all from before my children, and it's kind of continued and I've built on it. But I would say children are small for only a few years, and they're only your baby and children for the first 3-4 years. And I used to find this like such cringe advice when people said it to me, that your babies are small, they grow up so fast. But it's really true. Like my eldest is going to be 4 in January, so in 3 months' time, and I don't know where that time has gone. And you know, you can hear me say it, but until you actually go through it yourself, you won't realize. But enjoy the enjoyable parts of your parenthood, your motherhood, your fatherhood, whatever it is, and the hard bits will be hard, and you don't have to enjoy those. You know, everyone says enjoy every second, and when you're not enjoying it and it's really difficult and you're in pain or you're struggling and you're emotional, which it is at the beginning of your journey, you feel like, why is everything not perfect? Why am I not enjoying every second? And your baby's got colic and they're vomiting, and you know you're uncomfortable and you haven't slept in like 10 months. That's okay. You know, enjoy the good parts, and it's okay to know the hard parts are hard, and they will pass. So
amazing.
Yeah,
your journey, man, mashallah, is incredible. Honestly, like I knew this from before, obviously, from like your social media, that you got practice, and obviously I know about your book because I know people that bought your book, and obviously I've looked over it myself as well through the people that I know that bought your book as well, mashallah. But you know, you've done amazing, and I think you should give yourself a lot of credit. You help in dentists, even your family, your kids, and running a business. And I want to say thank you very much for coming down.
Thank you
all
for
this
having
way.
Me.
I know it's very far for you.
No, you came very close.
It was only 4 hours for me.
You came close to me, so thank you so much for making this happen.
No, I wanted this, honestly. I sat back and I thought, you know what, the one dentist that I want to ask to be on my podcast has to be you.
Oh, that's so kind.
I was like, you know what, mashallah, like on the way you are on social media, the way you're very passionate. Because sometimes I forget I'm quite passionate, and other people say it to me that, mashallah, you're very passionate. And I'm like that with anything.
Yeah.
Just even if it's something like setting up this podcast, no one's taught me anything.
Yeah.
I've learned everything about the tripods to the cameras to the audio, because I'm so passionate about not just doing dentistry but giving back. Sometimes I sit back and I think, what on earth am I doing? I could just go 9 to 5, go home and sleep.
Yeah.
But I'm putting myself in this situation and I can relate to what you're doing.
Yeah.
MashaAllah. And your birthday's approaching, so treat yourself, have a great time, and Jazakallah for coming down.
Thank you so much.
Dr. Raabiha, everyone.
Thank you.